Hey everyone, today I just wanted to talk a little bit about the coronavirus and really what I see as the elephant in the room in terms of susceptibility. Aside from age, we know that, or we're pretty sure that many people who are more susceptible to coronavirus have underlying comorbidities. So what does that mean? What's a comorbidity? That means that susceptibility to this virus is enhanced when you have certain diseases. So the top 3 comorbid states that we are seeing, and this is backed up by a paper that was published in the Lancet about 2 weeks ago based on data from some of the hospitals in China where they had ICU patients and they took percentages on what exact comorbidities were where those patients were in ICU, meaning they had more severe disease. And there really was a top 3. So number 1 was hypertension, high blood pressure, and number 2 and 3 are cardiovascular disease and diabetes. So if anyone knows me or has been to my practice or has seen any of the papers I've written or knows my practice at all, they know that one of my main focuses outside of pain, because as an acupuncturist and doctor of Chinese medicine, I focus a lot on pain syndromes. But the other number 1 thing that I focus on is metabolic health. Metabolic health meaning, how is your diet impacting your body? Do you have diabetes? Do you have high blood pressure? Do you have high blood sugar? Do you have abdominal obesity? Any of those markers of metabolic health. Because what I have seen in my practice over the years is that people don't get better, or very often don't get the progress they want with their pain syndromes because they have an underlying metabolic dysfunction. And when I say that, this is backed up by the NHANES data, which is a data set that's produced by the CDC, the Center for Disease Control, that reported that 88% of Americans have at least one marker of metabolic disease. So what does that mean? That means they have one of 5 things. Let me put it this way. That means that 12% of Americans are metabolically healthy, and that 88% of Americans over the age of 18 have one of 5 markers. Number 1, abdominal obesity. Number 2, high blood sugar. Number 3, high blood pressure. And 4 and 5 are lipid markers, meaning they have low HDL or low good cholesterol, and they have high triglycerides. Triglycerides are a type of fat that floats around in the bloodstream. So this is getting to my point, which the elephant in the room here is that high morbidity and mortality is a significant risk factor for coronavirus, SARS-CoV-2, also known as COVID-19, severity in these populations. Like, there is some talk that hypertensive patients might be more susceptible because they are often on ACE inhibitors, which the thinking is ACE inhibitor medications increase ACE2 receptors in the lungs. And we know that SARS-CoV-2, or the current coronavirus, COVID-19, gets into the lungs through the ACE2 receptor, of which there is only 3 coronaviruses known to man that use this ACE2 receptor. Coronavirus, the SARS-CoV-1 of 2003, which shares 87% similarity to SARS-CoV-2, this current one, and something called coronavirus NL63. So coronavirus NL63 has been around for hundreds of years. It's endemic to humans. but it typically only affects people who are immunocompromised, much older, or young, or very young children. But that one's been around for hundreds of years and functions a little differently. That more obviously, that one is not as deadly. So really the elephant in the room here in terms of, aside from this virus just being deadly on its own, I want to make that clear. I'm not saying that this virus isn't a problem at all if you don't have these metabolic markers. What I am saying is the elephant in the room, I know I've said that 10 times, bear with me, I'm not used to making videos, is that the more metabolic dysfunction, the more likely you are to get severe disease, and the more likely you are to die. In the Lancet report, 48% of ICU patients had hypertension. The ones that died, they had a higher percentage in terms of the diabetes and cardiovascular disease. Severe disease also existed in people with cancer and kidney disease, although that was at a lesser percentage. So what I'm saying today is it's time for people to start thinking seriously about their metabolic health. The conventional medical community or establishment has not dealt well with metabolic disease. There's a lot of misinformation. There's a lot of big pharma interests that want, I hate to say this because I'm not much of a conspiracy theorist, but big pharma has an interest in selling insulin and other diabetic drugs. Of course, a lot of people know this by this point, and I probably don't sound like I need a tinfoil hat at this point for most people to kind of sense that. I think most physicians are well-meaning, although I think they're plugged into a system that beats them down, and they also are sort of involved in a system where they don't get a lot of time to research or opportunity to discuss dietary and lifestyle management strategies with their patients. Okay, I'm going on and on about that. But what I really wanted to say was it's time to look at metabolic health seriously. I'm hoping that potentially that a silver lining around this issue, if there is one, is that people might wake up to the need for dietary and lifestyle management of their blood sugar and their metabolic health. The next question is, where do you go for that? So that depends. It depends on your physician, depends on how much time they have. It depends on what kind of system that you get plugged into as a patient. Here at my clinic, we use health coaching. We use dietary and lifestyle strategies as the main driver for resolving these issues. And we use a lot of education. And I think that people need to know that those opportunities exist. And right now, of course, we're all in quarantine. A lot of people are doing a lot of emotional eating. They're not really thinking about this stuff right now. But I think eventually we will collectively all be thinking more seriously about this. So again, I just wanted to bring up that elephant in the room here, backed up by research. And I just want everyone kind of thinking about going forward in the future and doing little things today. Maybe cut back on sugar. Maybe take an extra walk today. But know that there is help out there, and we can reverse a lot of these markers and get you feeling better. And more optimal health is really going to be the key going forward here, aside from social distancing and washing your hands, which are a given at this point. I think you've heard that ad nauseum. Thanks for listening.